At the outset, I must thanks Dr. Ragini for giving me this opportunity to present and to open this academic session of such a prestigious conference of the IMS. I really welcome Dr. Ambuja, Dr. Sudha, and all the very stalwarts and dignitaries of today's conference. The topic that has been given to me, that is what women need after age 65. I was finding that this is a very easy to speak because it is about me and the age around 65, that what I feel at this time. But then I searched the journals and just going to describe the things which is really what women need after age 65. And especially Dr. Ragini, your background that you were telling that it is at this age, I really think that it is not. It has to be like blue and the sky is limit should be the background. I will start my talk with this famous saying of Oprah Winfrey that is very positive note that so many women think menopause as an ending, but this is your moment to reinvent yourself after years of focusing on the needs of everyone else. It is your opportunity to get clear about what matters to you and then to pursue that with all your energy, time, and talent. So, with this positive note by such a famous Oprah Winfrey, I start with the positivity of this particular phase of life. But women approaching the age of 65 are undergoing a crucial transition, and that is going to progress towards older age. ये एक हकीकत ही है कि older age ही आएगी इसके बाद. So instead of being frail, fragile, and dependent, I am somehow very much fascinated by F. So instead of becoming frail, fragile, a woman needs that sound health, stable and caring family, physical and economical independence, good friends to share the problems, and quality time for herself. Very importantly, that screening for organic and non-organic ailments must be there, like inorganic, diabetes, hypertension, and the cardiovascular diseases must be taken care of. And the non-organic is the obesity, immobility, depression, mental problems should be taken care of at this age. And it is the duty of the physician, that is us, to disperse our knowledge to the mass population, and especially women at or beyond 60 years, and make them aware they also are having modalities to lead a healthy life, disease-free life, socially active life of their choice. So it is our duty to embark the knowledge, to put this particular phase of the life to the public, and they should also take knowledge from the doctors, from health workers, from the counselors, that they should go to the doctor to express their problems. So this is a time of liberation and positivity for women, positive changes, new beginning, new sense, and of the new sense of freedom at this age. But as I've said that I like the F instead of fragile and frail, there is the sky is the limit, that is the freedom. So we will not believe it that at this time, sometimes we feel that freedom from uterine and period problems are there. Many times I think and see the people at 40 or so, that they are worried for their dates, they are worried for their tampons, they are worried for going to the traveling, and they are worried for the periods. So we are free from that. The other is thing that no fear from pregnancy. So definitely this is the age when the ovarian functions are gone down and there is no fear from pregnancy, though it has a problem of the genitourinary and vaginal problems and the sexual problems at this age. This I put as the cosmetic, health guides and counselors, as it is very important that everybody should know that the nails, skin and the hair, they also are affected with the age, and many things are there to improve our images in the form of that cosmetics, then the nutrition, then the lifestyle, that we will have a healthy things, that is the outside, that is the nails and health and even the eyes. And I have just gone to the literature, and there's a big chapter that is said that the skin is also a sexual organ. And we are really knowing that always we are worried about our skin, that how we will look, how it looks healthy, how we can go for this cosmetic treatment at this age. Though it is a very much related to the economical background also. And the third is that vaginal rejuvenation for urinary and vaginal problems, which we are going to go discuss in our further meetings and the chapters. Actively pursue hobbies. And this is really, that is the freedom we are getting from our responsibility, major responsibility rather, and the economically, if we are sound, then we can pursue our hobbies. We have with us in our IMS members that really they are example that they are pursuing dancing just beyond 70 years, having this yoga teachers, and they are travelers beyond 60 years of age. And you all know them, and they are going to display their activities in this today and tomorrow conferences. The third is the lifestyle management, and that is the best and the must and has to be done. That is a lifestyle, and lifestyle management. And this just I put this flow chart that in the woman's life, there are the periods that initially, that is the menarche happens, then the reproduction phase happens, and definitely it goes to the premenopausal and the menopausal phase. Then comes to the postmenopausal, that is 5 years after 52 years of age. And that comes out to be the +2, and that is the later life in the menopause group. And in this group, that is the most important is the symptoms due to the atrophic changes in the urogenital symptoms. And that leads to the sexual dysfunctions, cardiovascular changes, osteoporosis, and the musculoarticular components, that is the sarcopenia. So at this particular chart, if you will even look at it, you are just getting a shivering that how the menarche and with this 65 age happens. It's such a beautifully flow chart depicting the ovarian, endocrine, and menstrual problems in women's life. I always remember Dr. Behram, who also gave this particular staging of the menopause and the life for a woman. And this is a very common, figures that you know, that is the decline in the estrogen that leads to the menopause changes. So in the hot flushes is the first and the most important thing. When the periods are still there, the menopause is going to set in, and the women feels hot flushes, the feeling of cold and hot, insomnia, and mood changes. So it is shifted to the genitourinary problems in the later, that is the 60 plus of the women, and it is really a problematic at this stage of the life. Then obesity, definitely in all the stages, it is a problematic. Osteoporosis and heart diseases. And in the last, that is when there is a mental problem, depression and dementia also sets in the later phase of life. This is a very beautiful slide. It is just focused on prevention, prevention, and prevention. And it is be divided into the four preventions according to the stages. And you will not believe it that we know all. And being a physician or the doctor, you are always thinking of the prevention. It is a primordial prevention at the childhood or at the infancy. That is the example like obesity, that even if the child is born, then we should be taking care of that. The child should not become obese to have diseases in the later life. So that is the primordial prevention. Then primary prevention is while then you are growing up, you are adolescent and adult, and you are just not taking care of, that is the stopping of the smoking, alcohol, weight reduction, and exercise. So if this is prevented at this early age, you just can go to the secondary phase, that is the secondary prevention, when it comes to the 40s and 50s years of the age. And at that time, that is the diseases sets in, and you have to take care of your prevention of the heart attack, repeat fractures, that is the osteoporotic care, and the complication of the diabetes or the metabolic disorders are the secondary prevention when ones go ahead in the life, that is 50 and above. And finally, there is a tertiary prevention, that is the aims at reduction of resultant morbidity due to diseases, like if you have the hip or knee replacements, kidney transplant, cataract extractions. So these are the diseases when sets in the old age. One has to be able to take care of these problems in the mean of the economically and the knowledge which is given by the doctors. And I really went to so many journals that so many research work is going on and so many guidelines are coming up to teach us. And our duty is to teach the public and embark our knowledge to the general population. In coming 5 to 10 minutes, I'm just coming up with these problems. This is very common rather in the age of above 60 or rather 65. That is the genitourinary syndrome, sarcopenia, sexual functions, osteoporosis, cognitive behavior, and obesity and the mental problems are really taking the toll at this particular age. And the doctor should have the more and more knowledge in this field and to treat the patients and make them very much comfortable in this age group of the 65. So one by one, a very short overview because the whole conference, it is covering these topics by the very stalwarts and very knowledgeable speakers throughout the day and tomorrow. And thank you, Ragini, for giving me this topic so I can just go briefly about the overview of these diseases. As far as the genitourinary syndromes are concerned, it is a syndrome that characterized by vaginal dryness, dyspareunia, urinary incontinence, and UTI. You will not believe it that the woman is fighting right from the 40 to 60, having so many of the menopausal symptoms and getting cure of everything. But at this age also, it is a very disturbing symptoms because of the decreased estrogen totally and the ovarian functions are off. So that makes that vaginal dryness and this particular problems of the genitourinary symptoms. And it affects really quality of life and it really needs treatment. As many, I remember my mother when she was having hot flushes, it is really going like without any treatment. And as the age advances, she really compromised and she managed to live with that. But this particular symptom at 65 or 60, it requires treatment and management. And that 52% of patients with GUS had some degree of the negative impact in the form of the 40% they suffered from the sex life, in the 17% because of the self-esteem, and the 7% of them suffer from the social life as they feel very much problematic to go out with the urinary incontinence and UTIs. So this affects a woman's life very badly in the genitourinary syndrome. And it is the slide that which I really want to make aware of the general public that as the estrogen loss occurs and the vaginal lining becomes thin and dry, there is a decreased blood supply. How to the vaginal tissues? Vaginal elasticity decreases, less of the secreting the fluid. Vagina narrows, and it leads to the dyspareunia and many urinary problems. So there is many modalities are there, and women should know at this time that there is a doctor, there is a modalities, there is a things that we can go to the doctor to have the treatment for these ailments. And it is really in the broadly that it is a surgical and non-surgical treatment. But at this time of my talk that we just focus about the cosmetic gynecology, and that is also coming in a big way. That is since last 10 years, so much of the cosmetic equipments and the energy-based devices are increasingly applied to improve function and aesthetic vaginal health. They seem to be an attractive option for management of genitourinary syndromes of menopause. So the population, we should disembark that this is a modality where we can treat these symptoms by cosmetic gynecology. The next we are coming to the sarcopenia. Is a common condition in the menopause women contributing to the functional decline, disability, frailty, and falls. Sarcopenia is multifactorial. It is because of the nutrition, age, diseases, and the mitochondrial apoptosis being the contributory factor in leading to the muscle weakness, that is the sarcopenia. Clinical intervention have to be focused for this particular ailment, and you will not believe it, that the severe sarcopenia results in low muscle mass, low muscle strength, and low physical performances. And about 50% of the muscles get reduction occurs at the age of 20 to 80 years. So this has to be tackled right from the beginning that one should not have this crippled problem of sarcopenia. Then this comes like sexual dysfunction or the sexual function in postmenopausal Indian women. So this is another category that is suffering after the 60, that is the menopause brings drastically physiological, physical and psychological changes due to declining estradiol level. Common sexual problems include loss of libido, orgasmic dysfunction, dyspareunia, and decreased sexual desire and activity. Sexually is closely linked to the health status at older age, health as well as the physical status at the older age. There are physical problems that women themselves suffered from but refuse to take available therapies, and they choose not to have sex, rather to go for the treatment. And also they are not aware of that they should go to the doctor and explain themselves. They are very shy. They are not going and they just think it that this is my age, this has to be stopped, this has to be gone. So it is the mindset that which we have to change. This is a very famous McCoy female sexuality, and I took this from the journal of Dr. Meeta et al. That is a questionnaire by McCoy, and they really take this few questions to the general public, that women, and they ask for the sexual interest, sexual satisfaction, vaginal lubrications, orgasms, and they put it in the chronological and in the chart form, and they got the things that it is a much difference in the peri and postmenopausal, economical and non-economic, the economical sound and the poor patients, and also the region-wise they are difference in this sexual activity. The number of the women regularly having sex declined with age, and it is really much decline after the postmenopausal phase and at the 65 also. So earlier researches on this was focused entirely on the biological causes, but a new study has been identified that is the psychological factor to play a role. Psychological in the sense that they are always very much conscious about their body image, that how they are looking, lack of the self-confidence, that they have become very older, and they are the partner's physical or herself some diseases that occurs, and then the stress and relationship issues occurs in the phase of this life with the sexual problems. Then the most crippling factor is the osteoporosis that sets in the woman as well as in this phase of the life. And you will not believe it that at the menopause there is a rapid drop of the estrogen, and that leads to the bone turnover and the accelerated bone loss that leads to the osteoporosis. And it is happening to a very remarkable percentage of the women. That is the 1 in 2 women over the age of 50 years are likely to have osteoporosis-related fractures, and remaining lifetime they suffer from this. So the menopause and osteoporosis, they go together, and that affects individual, family, community, and the nation. That is so much of the money that wasted in this particular problem of the osteoporosis. So one has to take care of the bone health right from the beginning. I think right from the 20 years when the peak bone mass is very important, that how healthy is one, and that is going towards the osteoporotic age, and they have the less of this, more the mass peak is the osteoporotic. This all everybody knows about it, that the being female is the single risk factors, and all the other as you are going through this. So then comes the lifestyle management, and this is a really crux of the things at this particular time. That is the lifestyle and lifestyle. So following one must follow the anti-aging diet that should have been more vegetable, as they have less calories and more nutrition. They should exercise regularly, especially the resistance exercise, de-stressing and keeping stress hormones like cortisol at bay. Change the attitude and remain positive in our behavior and our relationships. Cultivate personal relationships, spending time and our loved ones and loved actually does seem to improve longevity. It decreases stress and risky behavior when this go for the lifestyle management. This is a diagrammatic depicts that how is the diet, exercise, yoga, stress-free. This way of life makes you very healthy at this age. The other is the cognitive decline in the menopause. That is the changes in the cognitive ability is really a thing with the decreasing menopause, and the memory problem sets in at this 65 and above. And it needs a really healthy cognitive aging indicates that a diet rich in vitamin, omega-3 fatty acid, and antioxidants can protect adults from going to the cognitive problems. This is very good thing. There's so much less being said and sung of beautiful young girls. Why doesn't somebody wake up to the beauty of old women? She's so experienced. She is so vigilant. She is really taking care of herself and very strong. And it needs really good advice by the doctors also. And in the last, I think this slide is very important. That is, more connected we are with our friends and family, the better overall health. And having positive relationships with spouse, friends, and family are the best way to be connected at this stage of the life. And this is the whole thing is going towards the doctors, towards practitioners, that they should take care of this particular. And it is the age where sky is limit. So just be free from the frail, fragile, and fearful.